everyone, to the 2020 Celebration of Hope Virtual Gala. I'm Miranda Landsman, and I'll be your host for this event. We're looking forward to bringing you an incredible evening of informative interviews and compelling stories of our pancreatic cancer warriors and our legacy heroes. Of course, tonight's event is taking place of the usual Cena Magowitz Gala that we hold each year. We'd like to start the event by thanking our sponsors. This fall, we've brought you a series of virtual events that included some compelling conversations with those on the front lines of this fight. It's all culminating tonight with our virtual gala, and this is the final opportunity you have to support the foundation in 2020. So we're looking forward to your gift of hope this evening. I'd like to welcome our founder, Roger Magowitz, to tell us more. Roger, thank you for coming to us from your new home in Hawaii.
Thanks, Miranda.
And can you tell us about your vision for these virtual event series?
The virtual event was merely an extension of a live event. We wanted to celebrate our warriors, honor our legacy heroes, and thank our donors and have the fight continue.
Yeah, and it was an incredible experience to be a part of. Did you have a favorite part of this virtual event series?
Oh, my favorite part was definitely Dr. Jill's daughter, Hope. Hope was an inspiration for everyone, and at 13 years old, surely taught everyone lessons.
Yes, Hope did an amazing job, and she really did inspire. So what about tonight? What's on tap? What can people expect?
Oh, tonight we have a big lineup. We have 4 of the top pancreatic cancer doctors in the world. Dr. Dan Von Hoff, Dr. Erkut Orazansi, Dr. Doug Evans, Dr. Talia Golan, all the way from Israel. We have music, we have magic, we have 20-year survivors. We have very inspirational people that will speak. Stay tuned for a great evening, and thanks everyone for joining us.
Now we're going to kick off the evening with a little bit of entertainment. Now, many of you who have been to our events in the past have actually met Phil and Denise Sherman. They've taken fundraising on as a personal mandate and have been tremendous supporters of the Cena Magowitz Foundation. Phil is the president of Combining Technologies, and he and Denise have a fundraising campaign going on for this event. And Phil is also a terrific magician, so he's going to have a few tricks for us tonight. Phil and Denise, thank you so much for being here with us. Now, first, Denise, I know that you have been doing your own personal fundraising campaign. Do you want to tell us a little bit more about that?
Sure, thank you. It's such a great time to be here. I just want to tell you, over the last 2 months, I have had such a fun time reaching out to my friends and family. I've written emails, personal emails to friends, and have made multiple posts on Facebook and Instagram, all in the cause of trying to raise money for Cena Magowitz Foundation. And with that being said, would you like to know how much I raised?
Yes, we're all in anticipation. So please, drum roll.
The grand total is $8,386.
Wow, that truly is so incredible.
Thank you. And of course, with that being said, at the beginning of this campaign, Phil and his company, Pancreatic Technologies, they made a pledge to me that whatever I raised through my campaign, they would double that match. So the total is $17,772.
Wow, that's so incredible.
So
Phil?
It is incredible, Miranda, but the truth is that, like I said, we offered to match up to $10,000 of what she can raise, which means we still have another $2,500 we have to earn from everybody else that's watching this broadcast tonight, and say, hey, let's get her to her goal of $10,000 so you can max out my goal of $10,000 and make this a $20,000 donation to find a cure for pancreatic cancer.
Well, we're so thankful for the both of you and really just your generosity and your time and effort doing this. Now, Phil, I understand that you have a magic trick to show us that really goes along with this message.
Well, yeah, as you know, I'm an amateur magician, and I kind of figured I'd pull something out a little different that most people haven't seen. And it's basically done a trick with a little bit of a playing card and a $50. And I don't know if you can see this, but I'm going to stand, and if I'm out of the screen, that's a little bit okay. But basically, I'm going to take this $50. I'm going to do couple of things with it. I'm just going to turn my hand. And by the way, nothing on the card, but just want to show you that with a little bit of magic, with a little bit of faith, we can kind of make that coin kind of rise on its own.
Wow.
And what does that signify, really? It signifies that we're here to raise money for the cure of pancreatic cancer. And as you said, we're looking to make, come on down. There we go. What we're looking to do is take that money and actually make a difference. And as Miranda, you may have said earlier, we want to try to make an impact about taking that money and raising it and breaking through that money to raise more and more to find that cure. So a little karate chop to the coin, but also shows that we want to break through that barrier to the $20,000. We want to raise more and more and more to find this cure for our warriors out there fighting this disease, the Cena Magowitz Foundation, and let's get this thing cured once and for all. So thank you very much. Hope you like that.
That was incredible. And I love the visual representation of truly making an impact, which you guys have done. I mean, you've both gone above and beyond. So we're so thankful.
Thank you.
And we thank you. And we love participating in this event. And it's such a worthy cause.
We're honored to be involved.
Now we'd like to introduce one of the most important figures in pancreatic cancer research. Dr. Daniel von Hoff of TGen is one of the world's foremost experts in the field and has developed a number of clinical trials that are moving the needle in the fight against this disease. Dr. von Hoff, thank you for joining us today.
Thank you, Miranda. Let me add my welcome to the Celebration of Hope Gala, where I'll be introducing our next-gen investigators. And we're going to be speaking about giving pancreas cancer a nervous breakdown. For this gala, we want to feature our next-generation investigators. Some of you already know Dr. Erkut Borazanci, and he'll talk about his study, supported by this group, in patients with advanced stage 4 pancreas cancer to obtain tumor shrinkage by harnessing the patient's own immune system, made possible by this event and his plans against the disease. Dr. Talia Golan, who you may not know, a fantastic investigator from Israel, who this year gave us a new maintenance therapy to help keep people in remission. It was a real breakthrough for targeted therapy, and she'll tell us about her plans against the disease. And finally, Dr. Doug Evans, outstanding surgeon, probably the most outstanding surgeon in the United States, pancreas cancer. He's going to speak about his study for personalized treatment of early-stage pancreas cancer to make operable patients more operable and inoperable patients operable. And that study is just starting, again, sponsored by this event. But first of all, I'd like to give you a few words from yours truly. We want to remember some of the incredible people who have been at this event in past years, some incredible fighters, because we mourn their loss. Incredible, fine people, and all of us work to honor their memory. Our mission, strategy, and tactics with your gifts are clear. Our mission is an urgency to early detect and cure pancreas cancer. But our strategy is a bit different. We want to conduct guerrilla warfare-like clinical trials based on the best possible science, usually 10 to 60 patients in a trial, and look for dramatic shrinkage in response of patients' stage 4 tumors. Then confirm those with larger studies for the FDA, which usually takes about 800 patients and pretty long time, I'm afraid. and then apply those results to early stage patients with less burden, better chance for a cure. As a point of order, what do we mean when we use the word response? Response means more than a 30% decrease in the size of a patient's tumor. That's major shrinkage in stage 4 disease. As you can see here with these holes in a person's liver, that's the tumor. We call it a Swiss cheese liver, and before and after therapy. This is a pretty dramatic effect of a therapy developed under your auspices and support. A response, importantly, translates into a meaningful increase in survival, which is what we're after. Our tactics together are, number one, stay connected and meet with and listen to and capture the best science from all over the world. And some of the fantastic investigators that help us get these trials up and running are pictured here. And then we translate that best science into a clinical trial protocol that's doable within a budget. And then we have the very, very best clinical scientists, which I've introduced some already, perform the clinical trials as rapidly as possible, and hopefully generate the very best dramatic results to improve survival and apply earlier in the disease. Now, the only way to defeat pancreas cancer is you have to apply the best possible science against a disease. And we need to have and continue to have your help to apply that science to patient care as rapidly as possible. Our track record of working together on the mission is substantial. There's a lot of words on this slide, but on the left-hand side, we have the science concepts. For instance, number one is pancreas cancer is trapped in a scar. This is what it looks like in the middle, and to the right, the results of targeting that scar was we put together the regimen of Abraxane plus gemcitabine, shrinks 46% of patients' tumors. It was FDA approved for frontline treatment because of your support. Number two, we did molecular profiling, found a high enzyme in tumors versus normal cells. And to the right-hand side, started a regimen that gave a 45% improvement in survival for patients with stage 4 pancreas cancer. It became FDA approved, Onivide 5-FU regimen. Number three, molecular profiling showed us that DNA in pancreas cancer can't repair itself, so it has a vulnerability. And Gail Jamieson took us into a major trial of Abraxane plus gemcitabine plus platinum. 71% of patients' tumors shrank. Some have had complete disappearance of their stage 4 disease. This is now in a larger trial. And finally, based on the 2018 Nobel Prize discovering research that showed that cancer actually puts brakes on a person's immune system, so our immune system can't identify this foreign invader. It's hidden from the immune system. With the Cena 4 trial and mattress firm, Dr. Erkut Borazanci, to the right-hand side, he put together a 5-drug regimen we call the Grand Slam, 83% of patients' tumors responding, and he'll also speak about intra-tumor vaccination being supported by this event. So our goal is best science into the clinic for patients as soon as possible. Now, briefly, the new science concept we're working on at the time of this report today is we call giving pancreas cancer a nervous breakdown. Now, there's a great deal of accumulating evidence that cancer cells are under incredible stress. This year, in particular, I think we all can identify what stress is. But what stresses are cancer cells under? Number one, they've been growing under adverse circumstances for a long time. They have a lot of problems because they have a lot of chromosomes. They're so abnormal. So you usually would have 46, but the pancreas cancer cells have hundreds. Pancreas cancer takes about 19 to 23 years to show itself in a person. You can only imagine how many chromosome abnormalities, and yet the tumor cells still survive under that stress. They have a lot of scar, as we've already talked about. But what we haven't talked about, that scar gives you a very poor blood supply, low pH, low oxygen, high osmolality, so they're growing in a syrup-like environment, and very low nutritions, low sugar, low proteins, low amino acids. They have a lot of inflammation. And these tumors are under stress of chemotherapy and radiation, and yet some of these tumor cells still survive the stress. In reality, these tumor cells are under incredibly high stress, but they have to keep dividing, making the building blocks of DNA, RNA, and protein to make more cancer cells. And they have to stay alive, which means they need more and more nutrients to keep the metabolism going. Tumor cells need to eat. And as you've seen with many people, when they lose their muscle mass, these tumors even eat muscle mass. So these tumor cells are way out on a limb. The question is what can we do to saw that limb off? The new science concept we're trying to translate from the bench to the bedside this year is induce even more stress on these tumor cells to give pancreatic cancer cells a nervous breakdown. We want to overwhelm their coping capacities to kill the cancer cells in 20 seconds. And the question is, how can we do that? What's the science? Well, first of all, Gail Jamieson is trying to increase the stress of these pancreatic cancer cells by adding free radicals to the tumor environment. And to increase free radicals, you can use very, very, very high doses of intravenous ascorbic acid, otherwise known as vitamin C, not by itself, but in combination with chemotherapy. And we are seeing responses like this. The Swiss cheese liver we talked about, you can see how much that's reduced after only 9 weeks. Very dramatic response. This clinical trial continues. Just to show you how dramatic this is, many in the audience here are familiar with CA19-9. It's interesting that some of these tumors break up so fast that in that orange line it goes up, but every single person's marker goes down. You can see that all but one patient's tumors have been shrinking. That's below the line. We call that a waterfall plot. This is a very promising first step to increase free radicals to give those tumor cells a nervous breakdown. The next way to stress cancer cells is to use chemotherapy plus a ketogenic diet. In this mouse model, you can see that when you put chemotherapy together, which is the triple, we call it, Gail's triple regimen, and a ketogenic diet, KD, the blue line, that you get dramatic effect of improved survival. Long durations. This is very unusual even in an animal model. It improves survival. And the good news there is because of your support, this clinical trial has just started in patients with advanced pancreas cancer, Dr. Diane Hanna and Gail Jamieson, of the chemotherapy, the triple, which you supported, plus a ketogenic versus chemotherapy plus a regular diet. That is just starting. Stress those tumor cells. Another way to induce more stress on tumor cells to give them a nervous breakdown is deprive them of amino acids like methionine and arginine. And Dr. Hahn, who many of you know, is working on different GCN2 inhibitors in the lab, and we will bring that best into the clinical trial. There are also multiple other ways to stress pancreas cancer cells. There are things called proteasome inhibitors, which actually inhibit the garbage can of pancreas cancer cells so they choke on their own waste products. Does them good. We think this approach will cause tumor cells more and more stress so they literally give up. A final way to apply the ultimate stress to give pancreas cancer a nervous breakdown is to take out their oncogene engine. Oncogene is a cancer-causing gene that actually drives the tumors. This oncogene engine is called RAS, and it was called that because it was isolated from a rat sarcoma. I don't think the discoverers felt it would have any significance at one time, but believe it or not, it made it into our genome and causes cancer. And we have a little working mini group called the Avengers, working to take out that RAS engine. And there's incredible science from the special team using AI. That's why we call them the Avengers. And we have 2 oral agents which cause total blockade of this RAS engine. And we hope to start that trial sometime next month for patients if their prior therapies have failed them. We now have an easy blood test, thanks to your support, to measure stress in normal and cancer cells. It's called unfolded protein response. You put the cells under more stress, increase UPR. You can see here on this scale, a normal cell has some UPR, pancreas cancer cells that we said are under some stress. And our goal here is to push the UPR up so these tumor cells die in 20 seconds. So putting more stress into pancreas cancer cells will have a greater effect on pancreas cancer cells, giving them a nervous breakdown versus the normal cells. We call it a therapeutic index. Finally, an even better way to give tumor cells a nervous breakdown is kill them early, before they develop too many tumor cells and too many mechanisms of resistance, too many heads to lop off, like the Hydra. This would take much less of an increase in stress to kill them. So early detection, as we all know, is still the key. And we think the most promising early detection strategy is measuring EVs in the blood or urine. So let me just say a word or two about EVs. Extracellular vesicles, or EVs, are a terrific new tool for early detection. Believe it or not, the tumor cells and normal cells bud off these little packets of information and they circulate to other cells. We now call it the intranet of our bodies, EVs. The major effort to study these EVs for early detection is because they bud off of cancer cells and they have a unique covering and a unique content, and you can measure them in blood and urine. Easy test. What they contain also tells us what type of cancer we have. If you load them up with a tracer, they will go right back to where the cancer is because they have a zip code. It came from the cell membrane for imaging and early detection. And what's also interesting is you can actually load them with a therapeutic agent to kill the pancreas cancer, like what we call a STING agonist or IL-12. This is very, very exciting, and we're right in the middle of it. We're proud to announce that because of your support, we have a National Cancer Institute grant with all of the institutions, all the way from Japan, South Korea, many places in the United States, working on the early detection of pancreas cancer using EVs. And here's a picture of a team. Some have traveled great distances before COVID to be with us. This is a big deal. We're working on for very early cancer interception. Just to show you how good this is the diagnostic performance in the initial trials. What you want here on these diagrams is a right angle. And you want an AUC, area under the curve, that's 100. In other words, 1.00. And you can see here the cell-free DNA to your left, and then the exosome, or EV-containing microRNAs, is 0.95. This is very promising. We have a ways to go to 1.00, but this is very promising. So I think we will have a blood test, possibly a urine test, for early detection of pancreas cancer, where we can apply our therapies earlier. Certainly, it is clearly the way to achieve a high cure rate. Finally, I want to say thank you to so many for your support of the gala, of the clinical trials, of the walking and helping, speaking to other patients. Thank you for that support. It means a tremendous amount to us. It's also that support has encouraged other investigators against pancreas cancer. And you're going to hear from some of the next-gen distinguished speakers. What can we do to excite a patient's immune system to attack their pancreas? Dr. Borazanci. If we can get patients to response, how can we keep them there? Dr. Talia Gallen, who's going to tell you how to do that. And finally, if you find a cancer earlier, what can you do? An outstanding surgeon, Dr. Doug Evans, will speak to us about his personalized approach to this. These next-gen physicians, scientists, and investigators are the very, very best. Thank you again for your support.
Thank you, Dr. Von Hoff. The first of the three researchers Dr. Von Hoff mentioned is Dr. Borazanci of Honor Health. Dr. Borazanci is spearheading some remarkable treatments and clinical trials into pancreatic cancer, and he's joining us today from Scottsdale, Arizona to tell us more. Dr. Borazanci, what are some of the treatments and research you've been focused on this past year?
at Honor Health, what we do with our partners at TGen is looking for those newer therapies for pancreatic cancer. And in the last year, and really the last several years, we've collectively uncovered a lot of insights to better therapies for pancreas cancer based upon the biology of the cancer itself. Currently, we're very excited about a regimen that was supported by the Cena Magowitz Foundation, combining gemcitabine, nab-paclitaxel, and cisplatin, that had a response rate of 71% for people with stage 4 pancreas cancer. And what we mean by response rate is that the chance of really significant shrinkage in cancer throughout someone's body. And historically, these response rates have been between 20 to 30%. And so we're really excited about that regimen and those results, which were published last year in the journal JAMA Oncology. Since that time, though, we've been examining this combination in a variety of settings and looking at ways to add on to this regimen. So we're not really happy enough that it's 71%. We want to go higher and higher. And so every single person gets that deep and meaningful benefit and tumor shrinkage from pancreas cancer. So we've looked at combining additional treatments such as high dose ascorbic acid. And also we're wrapping up a trial that was also supported by the Cena Magowitz Foundation, where we combined gemcitabine, nab-paclitaxel, and cisplatin with IV vitamin D, the activated version of vitamin D, with an immunotherapy medication called nivolumab. And in that combination, we saw a response rate of 84% in 35 individuals with advanced pancreas cancer. So we're really excited about that, and we did a lot of extra analysis with these individuals. So we're hoping to publish that by the middle of next year. We've also taken that combination of the what we call the triplet and brought it to people that have localized pancreas cancer. And the hope with that is that utilizing that combination to get better long-term outcomes, to get to getting people to surgery, and then hopefully not dealing with the cancer again. And we've been really excited about the results. We finished up that trial. It was 24 individuals with localized pancreatic cancer utilizing the triplet regimen. And our primary goal for that trial was to see the rate of normalization of an individual's tumor marker. The most common one for pancreatic cancer is CA19-9. And we saw a normalization rate of 50% in those individuals with localized pancreatic cancer with that triplet regimen. And when you compare that versus the standard of the other the standard therapies for pancreatic cancer, that's about 21 to 25% CA19-9 normalization rate. So there's a lot of exciting things going on thanks to the support of the Cena Magowitz Foundation that we've looked at in both expanding the use of these therapies, but also in ways to refine them and to hopefully make them better. So it's really exciting to see that, and thanks to the support of the Magowitz Foundation.
Your work has been particularly focused on the immune system. Could you explain its role in a patient who's fighting this disease?
You know, our cancers can be very difficult to treat, and they can utilize a variety of ways to evade our immune system from attacking it. You know, the old adage about you have a bad immune system with cancer is not true. The reality is that these cancers are very good at telling our immune cells that, hey, I'm not the bad guy here, don't go after me. And if you look at other cancers, cancers such as melanoma, lung cancer, bladder cancer, kidney cancer, there's a lot of promise and a lot of exciting activity going on looking at medications such as nivolumab or pembrolizumab that can unlock the immune system just by giving it by itself, and allows the immune system to attack the cancer. And some of those individuals have had long-term impressive results. If you look at even former President Jimmy Carter, who had very advanced melanoma, he received a type of therapy that stimulated his immune system to go after his cancer. And despite having cancer in his liver and his brain, he's done remarkably well the last few years. Pancreas cancer is a little bit different. Pancreas cancer tends to surround itself with a barrier, and it can be very difficult to get the immune cells into the tumors themselves. So by itself, the same therapies that have been so effective for melanoma and lung cancer don't work so well against pancreas cancer. Pancreas cancer evades the immune system better, and both physically and also on how it tells the our immune system to not go after it. To that end, though, we have seen some encouraging results with combining chemotherapy with immune therapy. As I mentioned before, the trial that we combined, we call it the Grand Slam, where we took the gemcitabine, nab-paclitaxel, and cisplatin with the vitamin D medication and the immune stimulating medication, nivolumab. We saw a response rate of 84%. And so that was encouraging. What's also, what we're really excited about too is that, again, thanks to the Magowitz Foundation support, is soon to be launching a trial where we're actually injecting into the tumor itself, into people with pancreas cancer who have progressed on standard conventional treatments, chemotherapies, injecting agents that stimulate the immune system into the tumor itself. By doing so, it appears what happens is that these cancers, which we tend to think of pancreas cancer as being very cold as far as how it relates to the immune system, turning these cancers from cold into hot and allowing our own immune system to go after these cancers a lot better by flipping the script that these cancers do to us. So that trial was based upon tremendous work done out of Dr. Levy's lab at Stanford University. It's been brought to the clinic, and we're hoping to start this trial very, very soon. It's going to be a combination approach with different investigators around the country, at Stanford, led by USC, and here at Honor Health, and looking at that combined approach to inject the tumor, but also stimulate the immune system to go after the cancer all over our body.
And how has the work of foundations like the Cena Magowitz Foundation benefited your trials?
It takes a village, right? It's impossible for any one individual to do this by themselves. And there's the reality, if you look at other cancers that have had tremendous success, if you look at breast cancer, for instance, breast cancer has been driven by tremendous advocacy and support over the last 2 decades. And the expectations based upon the support for people with breast cancer is that people are getting a lot better outcomes because the awareness is higher, detection is better, and now the management and the insight of the biology about breast cancer is light years ahead than it was 20 years ago. That type of effort is what's needed to crack pancreas cancer. And because of foundations like the Cena Magowitz Foundation, which has shown a tremendous commitment over the last several years to really support individuals and groups of teams to come together and bring that best science to people with pancreas cancer, has allowed those breakthroughs to occur. We still have a long way to go, but we have made tremendous progress. And without that support, it doesn't lead to that next step. And I have to say this, one of the most rewarding things that I've seen with our triplet trial was that that triplet trial was initially a 10-person trial that was supported by the Cena Magowitz Foundation. It then expanded to 25 individuals for pancreas cancer, and now it's in a greater expansion that's supported by the makers of nab-paclitaxel Celgene and in pancreas cancer. But the other part of it too is that our colleagues at the Mayo Clinic and at MD Anderson saw that regimen and said, hey, we like to do this, we like to give this to people with biliary cancers, cholangiocarcinoma and gallbladder cancer. And so they took that regimen and are now investigating this regimen for people with other types of cancers. And so seeing that impact from a 10-person trial blossom is incredibly rewarding, and that's where that support goes. It goes a long way to build upon those successes, but also to encourage others to not only utilize that treatment, but also study it in a variety of situations. So that can't be done without the support of organizations like the Cena Magowitz Foundation.
What would you tell people about advancements in pancreatic cancer and what they mean for patients and their loved ones?
I think that the reality is that we all know how difficult pancreatic cancer can be, and historically it has been a tough cancer, and being able to utilize newer therapies through clinical trials to build upon the success from before has led to tremendous individual stories. There are individuals that are walking here that were told years ago that they had a couple of months to live after they were diagnosed with advanced pancreas cancer. And what this support and what these newer treatments are able to do is that for individuals getting to that next anniversary, it could be another birthday, or they want to see a child's graduation or a grandchild's birthday, or being there to be with their family, to see that next big anniversary has been a tremendous impact to that individual themselves, but also to their family. And while it's not every single individual, what we're striving to do is we are striving to offer more focused therapy and better therapy for more individuals so they can live with this cancer, and eventually we hope to beat this cancer. And the biggest thing that really is going to lead that path forward is simply the fact of awareness and early detection. As we get better with our tools to diagnose this cancer earlier, we have the opportunity to intervene a lot earlier. So instead of seeing individuals that have stage 4 pancreas cancer where it's spread to other organs in their body, we are starting to see people on that earlier stage where they could potentially get systemic therapy, but also go to surgery for a chance for a long-term cure. And so that's the value, and being able to see some individual, they're a mom or a dad or a grandfather, a grandmother, aunt, uncle, and being able to share with their family is a tremendous reward to see. And we want to see this more and more often. That's what drives me to look for those situations, because nothing rewards you more than seeing those individuals cross those milestones, and also being able to look at scans and say, look, here's what's going on. We see shrinkage, and these same individuals were told the exact opposite before by so many other physicians.
Dr. Borazanci, thank you for continuing your groundbreaking research and moving us closer to a cure for pancreatic cancer.
Absolutely. I thank you for the opportunity to share that experience from my standpoint. And obviously, I can't thank the Magowitz Foundation enough as far as what they've meant for my patients over the last several years. So together, we're just going to continue to fight this cancer.
Now we have a very special guest coming to us all the way from Israel. Dr. Talia Golan is one of the world's foremost experts in groundbreaking treatments for pancreatic cancer patients. She's developed a special maintenance regimen to keep patients who have BRCA-mutated pancreatic cancer in remission after chemotherapy. Dr. Golan, thank you for joining us. Why did you get involved in pancreatic cancer research, one of the deadliest cancers?
My parents are both physicians, so I was really brought up in a house that healing, caring for others just seemed very natural, and it was something that I always wanted to participate in from quite a young age. I also grew up in a house where there was a thirst for knowledge and gaining knowledge and being curious and asking questions. So I very happily went into medicine, I must say. And in medicine, I very naturally chose oncology. I felt that I could have meaningful patient care, meaningful relationships with with the families and the patients, and also the opportunity to do some research that I was always interested in. Specifically why I chose pancreatic cancer, I can't really put my finger on that. I think that there was just something very devastating about the disease that didn't put me off. I think it pulled me towards the disease. So I didn't feel turned away from the patients and the family. I wanted to be there for them in that way. And I think that the fact that the disease is so tough and so difficult to treat, and the biology of that really intrigued me. So it was kind of like a magnet. It just pulled me towards it, and I went willingly, I think.
How does the treatment you developed work, and who does it help?
Yeah, so I co-led the effort of olaparib, which is a PARP inhibitor. It's a biological agent. We used it in patients that were identified to have a germline BRCA mutation, which is a hereditary gene that causes different kinds of cancer, for example, breast, ovarian, prostate, and pancreatic cancer. In these patients, we treated them with chemotherapy. It had to have platinum because patients with BRCA mutations have a real exquisite sensitivity to that kind of drug. The problem is that the chemotherapy over a course of time becomes very debilitating to the patients. The neuropathy with the tingling in the hands and the feet can really impact our physical activity and the way we feel and our discomfort. And then the progressive hematological toxicity with the chemotherapy is also one of the things that really just limits how long we can use it and in what doses. So we actually brought the PARP inhibitors into these patients, thinking that maybe there's a way to maintain the effect that we got with the chemotherapy. It was quite novel at the time when we designed the study drug and the study design, because people were kind of thinking, would maintenance ever work in a disease like pancreatic cancer with such a limited overall survival? But we felt that if we identified the right patient and we treated them in this specific strategy of chemo for several months and then maintaining that with this olaparib PARP inhibitor drug, we would be able to impact their disease. The drug got approval from the FDA at the end of 2019 and recently in EMEA. So it's been a very, very, very exciting journey. And I'm very grateful to all the participators and the families and mostly the patients that were prepared to be in a trial like this, because it was randomized also for placebo. So that's always difficult for all of us.
And Dr. Golan, what sort of results have you seen from the approach that you have taken to the treatment?
So what we saw with the drug is that we extended progression-free survival in these patients. And interestingly, in the patients that actually have a response, it's a smaller fraction of the patients, but those responses went on for more than 2 years. So when the drug works and it helps, the effect, the durability of that is really evident on the patients. I have a small percentage of patients that have gone into long-term remission, so their disease has kind of disappeared for more than 3-4 years now. that was something that I couldn't really envision seeing. It seemed a bit impossible, and it's possible in some patients. And I think that that is really like, the fact that it can happen is really a ray of light for us, that if it can happen in several patients and in this disease, then, you know, we just have to find other patients with other genomic alterations and new drugs and, you know, just carry on this, but it's possible.
Thank you for explaining that. And over the years, what sort of improvements have you seen in the treatment of pancreatic cancer?
So I think for the majority of our patients, the mainstream of treatment is still chemotherapy based. But over the last several years, we've seen identification of what we would call low frequency specific alterations in the tumors or germline mutations. And these mutations are what we would say is actionable. So there's a biological treatment that can actually treat these low frequency mutations. And if you think about it, we're kind of starting to really break up pancreatic cancer into smaller, some of them are really small subtypes, but they're identifiable. And some of the responses that we're seeing are really meaningful. So once again, for the majority of our patients, we still have the chemo standard of care approach. But in a smaller minority, we're definitely becoming much more precise about identifying those tumors, the biology of those specific tumors, and how we treat them.
That makes sense. What would you tell people about the advancements in pancreatic cancer and what they mean for patients and their loved ones?
It means that there's a ray of hope. It means that you may not be in that small fraction of identifiable, actionable mutations, but it means that it's there. And if we've managed to decipher some of them over the last several years, it means that we're on the right path. And I really believe that for the future, we have still a lot of work to do, because for the vast majority of our patients, we haven't been impactful enough on how we change the course of their disease. But there's deeper understanding about their tumors, and I think that in the future that is going to translate into how we treat those patients.
Dr. Golan, in your experience, why are foundations like the Cena Magowitz Foundation so important?
So I think this has been a real learning experience for me. It wasn't evident to me at the beginning of my career how this isn't really, it's not only my problem as a treating physician. This is a scientific problem. This is a medical problem. This is my problem as a treating physician. This is also the researcher's problem. This is the patient's problem, and it's their family's problem. And only once we all get around the table and start working on this together will there really be an opportunity to make a difference for this devastating disease. And it took me a while to understand that this is, we really all are, we're all on the same side, and we all really focused around the same problem. And I'm grateful for people like Roger Magowitz that has taken his loss, which I can't even imagine, and turned it into something powerful, something about doing, giving, making, believing that it can make a difference. And I've seen over the years how these kind of foundations definitely make a difference.
Dr. Golan, thank you so much for taking the time to speak with us today. And thank you for the incredible work that you're doing for pancreatic cancer patients.
Thanks, Miranda, and all of you keep well and safe. Bye from Israel.
The Cena Magowitz Foundation is committed to the cause of funding pancreatic cancer research and has been especially focused on funding clinical trials for potential new treatments for the disease. One of those trials is being conducted by Dr. Doug Evans, professor and chair of the Department of Surgery at the Medical College of Wisconsin. Dr. Evans is on the front lines of research on this disease and is here to tell us more about his critical work. Also with us today is Jack Chase, one of Dr. Evans' patients. Thank you both for being here.
Well, thanks, Miranda, and thanks, Jack, so much for joining us. It's great to be here, and we owe so much to the Cena Magowitz Foundation. It's just a wonderful group of incredibly committed individuals who support our work. So important.
We appreciate it. And now, Dr. Evans, we know it was important to you that Jack's perspective be included in this interview. Can you tell us more about that?
Well, as I've mentioned many times, the treatment for pancreatic cancer can be easily thought of as a marathon. It's emotionally, physically taxing. It's very difficult for patients and their families. One of the reasons why we don't have more patients like Jack is simply that people are emotionally exhausted after their treatment, and then trying to become advocates for this disease is oftentimes very difficult. And for people right now who are receiving chemotherapy, radiation, they're either getting ready for a big operation or trying to recover from a big operation. Hearing from people like Jack is just so inspirational, so important. It brings energy and enthusiasm to them. Jack and I share a tremendous passion for baseball. We're huge Brewers fans. And for those of you who have any doubt the Brewers will be back next year, not to worry. And
started back in 2013. We started out with, we did chemo once a week, radiation 5 times a week for 4 months. Then I had a month off to help recover, did our Whipple. And then I had another month off and went back on chemo for 4 more months, and ended in December of 2013. And very exhausting, but worth every penny and every minute of it, because I've got to see many things. I got to see a grandson born. My granddaughter just turned 10, and I enjoy every day of it.
Wow. So that was 7 years ago. How are you feeling now?
I feel fantastic. Like I say, every day is a journey. It's beautiful outside today. It's a great day here, and I'm looking forward to going outside and doing some work on the farm.
That's so awesome. And what would you say, I guess, to encourage other patients that are in your similar situation? I mean, you mentioned that doctors told you you had less than a year.
Yes, yeah, yes, and it's just amazing that how it can turn around, and how by finding Dr. Evans and the right treatment, it's everything is possible. Yeah, and my treatment alone was over 8 months, and amazing. Like Shannon from your office, she was fantastic. She babysat me. Yeah, and Faye, my fiance at the time, she's now my wife. She supported me every minute of the day. I mean, there's times that was very, very dark. It was very hard, you know. I went to work all through it. There was times she had to come pick me up because I couldn't have the energy to drive home. The family support and friends too were just amazing. It's the people around you make you. And I was surrounded by a lot of very positive people.
Oh, fantastic. Good for you. Well, we're so thrilled you're doing so well. It's absolutely wonderful. And our quest and the support from the Cena Magowitz Foundation is going to make sure that we have more Jack Chases in the future. Absolutely.
Yes, and thank you so much for being here with us today, Jack, and sharing your story. We wish you all the best on your journey.
You're welcome. Very nice meeting you.
Dr. Evans, to start, how did you get involved with the fight against pancreatic cancer?
Well, I became interested in pancreas surgery probably as a medical student. I went to Boston University School of Medicine, and as part of my financial aid package, I needed to direct undergraduate dormitories on the Charles River campus. And as you would imagine, and this is back in the 1980s, it wasn't very easy to study in undergraduate dormitories. So fortunately, the Leahy Clinic was across the street from me, and I had a little part-time job also at the Leahy Clinic. And I studied in the Leahy Clinic library, and many of the beginnings of pancreas surgery in the United States started at the Leahy Clinic with a couple of very, very well-known surgeons. And then I did my residency at Dartmouth, and was fortunate to work with a very skilled surgeon named Dick Carl, who had an interest in pancreas cancer. And I then went to the University of Texas MD Anderson Cancer Center for my fellowship. And really my main interest at that time was pancreatic cancer. And I was fortunate that Charles Balch, who was the chair of surgery at the time, offered me a job to stay, and ended up staying in Houston for 19 to 20 years and really focused on pancreatic cancer. And it was a disease that really had very few options in the mid 1980s, and we've made just incredible strides. One of the things that we were interested in from the beginning was really how best to combine chemotherapy, radiation therapy, and surgery. And I think the patients in the audience and those patients or family members that are listening to us will appreciate that pancreatic cancer is unique and that it really is a multi-system disease. There are challenges oftentimes with the bile duct. Patients need a stent or some way to decompress their bile duct. Really, our technology in stent management really didn't develop until the 1990s. I mean, it really is not that old. We also have to pay close attention to nutrition, to blood sugar management. Oftentimes diabetes is an accompanying factor in patients who are diagnosed with pancreatic cancer. And it's crystal clear that a combination of chemotherapy, radiation therapy, and surgery is superior to any one modality alone. And the trick then is, how are you able to take a patient, most of whom are in their 60s or 70s, occasionally 40s and 50s, but they're not in their 20s. So how can you take a patient who may have other medical issues, be it a little bit of heart disease or some other medical issue that is a little bit of a challenge, and get them through, as Jack mentioned, 6 to 7 months of treatment to include, in the end, what will be a fairly large operation. So it's a disease that really I have devoted my life to. I know that there are many other physicians and scientists who have done the same, but the rewards could not be greater. The patients are so grateful, and their families are so wonderful.
And we're so thankful that you have devoted your life to this research. In fact, will you tell us about the clinical trial that you're working on now, that the Cena Magowitz Foundation is actually a part of funding?
Sure, that would be great. And my huge thank you to the Cena Magowitz Foundation, because such high-risk proposals would not be possible without foundation funding like this. So the technology we're using is quite sophisticated and state-of-the-art, but the fundamental theory and the principle is very straightforward. So right now, with the best possible chemotherapy that's available in the United States, approximately a third to a half of patients will benefit. Certainly some of the unique combinations that Dan von Hoff and Erkut Berzansi are putting together, that number is getting even higher. But in general, or outside of really unique clinical trials that we're doing, for the many patients, for the thousands of patients in the United States, and certainly for the millions of patients worldwide, the likelihood that they will benefit from the chemotherapy they receive is probably a third to a half. And that means that a minimum of a half of the patients, 50% of the patients, have no chance of benefiting from the chemotherapy that they receive. What this trial aims to do is, through a tiny needle biopsy of the pancreas, do a very sophisticated genetic profiling using RNA technology that was developed at the University of North Carolina. We're doing this in collaboration with Dr. Zhenjian Ye's laboratory at the University of North Carolina, and determine the genetic profile. And the terms that we use are classical versus basal, the genetic profile of the tumor as a guide to the initial chemotherapy. We know that whether a patient has a classical tumor, as defined by their expression of a series of genes, or whether they have a basal-like tumor, will determine their response rate to the most commonly used chemotherapy, which is abbreviated as FOLFIRINOX. This technology is quite unique. It's not something that is commercially available, and no one prior to us has been able to do this on a needle biopsy, which provides a very small sample size. The technology now has been worked out. So what we're trying to develop, you heard recently from Jack Chase, one of our patients, who now is a 7-year survivor of pancreas cancer. We typically equate that with a cure. Pancreas cancer recurring at or after 7 years from treatment is essentially unheard of. What we want to do is create more Jack chases. So Jack was treated with a similar paradigm of chemotherapy, radiation, and surgery. His was a bit different because it was quite a while ago. And we obviously were very lucky that we picked the right treatment for the vulnerabilities of his tumor in a patient who had the optimal host response system. For every Jack chase back 7 years ago, we unfortunately had 2 patients who were not that lucky and their cancer recurred. With this trial supported by the Cena Magowitz Foundation, we want those 2 patients to move into the Jack chase category and have all of our patients be 7-year survivors. Even more importantly than this relatively small clinical trial, this could easily change how pancreas cancer is treated in the entire world, because patients could virtually every patient receives a needle biopsy to confirm the diagnosis before they receive treatment. So easily a year, 2 years from now, every patient, especially in the United States, could receive this needle biopsy, undergo this genetic profiling, and then receive the right chemotherapy to optimize their chance of response. So we're so excited with this.
Yeah, it's so exciting. I mean, you talked about what you're hoping the results are. What's the best case scenario that comes from this trial, in your opinion?
Well, I think the best case scenario would be the way we're treating patients is they receive a minimum of 2 and certainly hopefully at least 4 months of chemotherapy, to which we would like to see a response. And we measure that response 3 ways. Number 1, how the patient is doing. Those patients who respond well to chemotherapy typically feel better. Even though they have some side effects from the chemotherapy, their week off from chemotherapy, they feel better. If they had pain due to the tumor at diagnosis, that pain is better. They begin to maybe eat a little better, they stay hydrated, et cetera. So we assess how they're clinically doing. We also look at their CT scan. We repeat their CT scan every 2 months. We would like the tumor to reduce slightly in size, even though it may not change with respect to its relationship to adjacent blood vessels and other aspects of human anatomy. We would like it to maybe get a little smaller. And then third, we look at biomarkers in the blood. In this case, we're looking at a variety of sophisticated biomarkers in the blood, but I think many of our audience will be familiar with so-called carbohydrate antigen 19-9 or carcinoembryonic antigen, CEA. So we measure CA19-9 and CEA levels, and we would like that CA19-9 level to decline. About 75% of patients produce CA19-9, approximately 20 to 25% do not, based on their Lewis blood group antigen. But if they produce 19-9, we would like that 19-9 to go down. And our hope is that would occur in virtually all of our patients. Clearly that may not be the case, but we would like to have the most effective therapy delivered at the beginning to every patient with pancreas cancer. Right now, when a patient receives ineffective treatment, that isn't appreciated for 2 or 3 months. I think everyone would realize that after 1 dose of chemotherapy, it's probably impossible to know whether it's the right chemotherapy. But certainly after about 6 to 8 weeks of chemotherapy, we get a feeling for whether that chemotherapy is working or not. And in this particular trial, our goal is that we will know after the first 4 doses of chemotherapy, so after approximately 7 weeks of treatment.
Dr. Evans, we talked about the treatment of pancreatic cancer. I mean, you've been with it really since the beginning. How would you say it's changed over time?
Well, I think one of the big changes is there now is optimism. And I think that's so important. I've mentioned before that the treatment is a marathon. And I think for many patients, they remember that everyone has a varied team of support. We would love to have every patient come to us with a team of support that would ensure that they had someone to drive them back and forth to the medical center, that they had access to proper nutrition, to hydration, that they had someone kind of boosting them up when they were feeling emotionally down. That is not always the case. And I think 10, 15 years ago, it was even harder because there wasn't that optimism that exists with the disease today. And to be honest, a lot of that optimism comes from places like the Cena Magowitz Foundation and other foundations that just provide that support. I mean, one thing that we're missing in the pancreas cancer world is we're missing advocates like the Cena Magowitz Foundation. I think because pancreas cancer is exhausting, and you know, when you compare the treatment for pancreas cancer, you would compare it perhaps to bone marrow transplant and solid organ transplant. Just think about this for a minute. Compare the advocacy that you hear about on radio, TV, when you watch a football game or a Major League Baseball game. You hear about breast cancer, you hear about prostate cancer. How often do you hear about the people who undergo a bone marrow transplant, or the people who undergo a heart or a liver transplant? They're grouped with pancreas cancer. You hardly ever hear about the plight and the challenge and even the successes of those patients. And I would argue it's because the treatment is so rigorous and to some degree exhausting. And even when we have our greatest successes, many people are simply too tired to then pick up the flag and keep the charge going and do what they can. And I think that's what's so wonderful about Roger, about his family, about the Cena Magowitz Foundation. I mean, it's just fantastic. And I think with more energy, with more enthusiasm, you will see purple ribbons on the helmets of Major League Baseball players. You're going to see them on the cleats of the National Football League. I mean, we're going to get to the point where breast cancer advocacy and prostate cancer advocacy and others are right now. And I think hearing about pancreas cancer, November is Pancreas Cancer Awareness Month. We have a couple radio shows right in Milwaukee, sponsored by the Department of Surgery on WISN, which is part of iHeartMedia. And I think you know, we bring this forward in our radio shows virtually all the time. But for patients, hearing about the energy, the enthusiasm, the fact that our treatments are orders of magnitude better than they were 5 years ago and 10 years ago, that alone is translated into hope in the minds and the hearts of patients and their families. And you know, that hope for a better outcome, even if that hope is not necessarily linked with a cure, but that hope for a better outcome is just so important.
So, Dr. Evans, you talked about the Cena Magowitz Foundation. What would you say to encourage people to support and really get behind organizations like the Cena Magowitz and just support the work that they're doing?
Absolutely. Well, I can tell you our commitment to the Cena Magowitz Foundation is that we will provide innovative clinical trials that people can wrap their arms around. And I think if we, those of us who are involved in cancer research, if we provided a more tangible and understandable explanation of what we were trying to do, I think people would donate to us. They would support our cause. I think it's when you compare cancer research and wonderful groups like the Cena Magowitz Foundation, you compare that to the other great things that people support in our communities, which are wonderful. The symphony, the art museum, the boys clubs, the girls clubs. I think the reason that they're so effective is that there's nothing abstract, that people in the community can say, I know I'm going to make a donation to the boys clubs of Milwaukee because, you know, they're in our underserved populations and they're supporting that inner city baseball league. I mean, there's something that is tangible there. What we're trying to do is provide that tangible, easily understood concept to cancer research and also to the Cena Magowitz Foundation. We're going to change how pancreas cancer is treated in the entire world with this clinical trial. I mean, I have absolutely no doubt that that will be the end result of this, and that the technology we're using for biopsy of pancreas cancer, this technology will be applied to every single patient who is newly diagnosed in the United States. And instead of taking a chance, in other words, when their doctor applies their first treatment to them, and there is about a 1 out of 3, maybe 1 out of 2 chance that that treatment will be the right treatment. When we get through with this clinical trial and this technology is adapted worldwide, there'll be a 1 out of 8. I mean, there'll be a 8 out of 10, 9 out of 10 chance that that treatment will be the right treatment at the very beginning. And certainly with pancreas cancer, I think no patient has 2 months to waste. Probably 1 or 2 weeks doesn't make any difference, but 2 months is a long time with pancreas cancer. So I would encourage everyone who has been inspired by Roger and his family, by the Cena Magowitz Foundation, to think about this. I mean, we're doing things that hopefully everyone can wrap their arms around and completely understand. You know, we're not trying to make, as Dr. Dan von Hoff often says, we're not trying to make a little difference. We're trying to make a big difference. And the trials that are supported and the cancer research efforts that are supported by Cena Magowitz, they have high aspirations. They're designed to really change the landscape of how this disease is treated.
Dr. Evans, thank you so much for taking the time to speak with us today. We appreciate everything you're doing, and we're really looking forward to seeing the efforts of this trial unfold.
Well, my pleasure, and thank you again to Roger, the Magowitz family, the Cena Magowitz Foundation, and everyone who has supported this tremendous cause. We're so excited and also so grateful.
Wow, what an inspiring and really educational segment by Dr. Evans. Roger, what are your thoughts? I mean, how do you think the night's going so far?
Anytime we could get 4 of the top doctors from around the world together on one program, especially for the Cena Magowitz Foundation, is incredible. They educate, they enlighten us, and they always inspire us. Thank you, doctors, for helping us and our patients and our families that come to watch us for the voice of pancreatic cancer.
Yeah, and really just highlight the importance of what we're doing here. I mean, raising money to support trials like the one that Dr. Evans described. And there's a lot of fun ways that you can actually be a part of raising money. We have amazing raffle, silent auction items. Roger, what are a few of your favorite silent auction items up for grabs tonight?
Well, we always try to put a bunch of jewelry in our silent auction, especially getting this close to Christmas. It's a great way to help a cause and give a family member a great gift. We have trips, we have baseball suites, we have a lot of incredible stuff. We have mattresses, of course. We'll have pillows, we'll have sheets. So please, if you haven't bought your raffle tickets yet, there still should be time to buy them. And you could support us by buying these items. You can support the doctors that help us with these clinical trials. We still need a lot of money. We still have a long way to go. This is our final event of the year. So please, if you could be generous, tonight is the night to do it, folks. We need your support desperately. And just remember, if not me, then who? That who is you. Thank you all for coming and joining us at our event, and keep having a great time through the evening.
Well said, Roger. Now we want to bring you something very special tonight. We're sharing the stories of 2 long-term, more than 20-year survivors of pancreatic cancer to share with us how they've been able to battle the disease and live long, productive, and happy lives. We invite you to meet Bill Evelyn and Kay Case. Let's hear more about their stories and how they're fighting pancreatic cancer. Bill Evelyn is joining us now. Bill, thank you for being here with us.
Thanks, Brenda, for having me. Appreciate it.
Bill, when were you diagnosed and how did you find out you had pancreatic cancer?
I believe it was June of '98. Like I said, I just moved down to Fort Lauderdale, started a software engineering job down there with a startup company. And all the time I had been sick and throwing up, and I thought it was kind of just acid reflux. And I finally went to went to Miami University Sylvester Cancer Clinic, as the VA, the Veterans Administration had one of my doctors had recommended that I go there and talk to the chief surgeon. They did their PET scan and they found the large, tumor on my pancreas on the tip of it. He said, I can't tell if that's cancer or not, until I get in there and dig around and find out. He goes, so I need your, I wish I had it for the longest time. He had a manila envelope, a big brown one. He drew this big horseshoe, which is now on my belly. He says, I'm going to take this, put a big line through. I'm taking all that out. And I'm like, okay, I just don't want to be in pain anymore. So you do what you got to do. And so I really didn't know until I woke up from the surgery. And he says, oh, you're a lucky boy. You had about 3 months to live. And it's good that you got in here when you did. So I really, believe it or not, I didn't know until after the surgery. But I know that, 3 months to live versus, I'm still here 22 years later. That's when I found out.
And how have you been able to battle this disease for so long? What keeps you going?
It's something I keep an eye on. I don't have a lot of recurring treatment. I have a lot of scans, and I've got 6 tumors on my pancreas right now. And I do have a what's called MEN1 type 1 familial, which is a multiple endocrine neoplasia, which also runs in my family on my mother's side. I know that they're called NETs, I believe, neuroendocrine tumors. I still have 6 that I get scanned for, so they'll find out if they turn to cancer, because I believe that's exactly what happened the first time. It's something you can't really. Back then, I think it was 1998, they didn't have a way to really, look for it. They did a PET scan and they brought it up on screen, this big 3D model, and I'm looking at them and I saw that's in my stomach. They said, oh, it's on your pancreas. So they're going to do a Whipple, cut it out. Since they've done that, 6 more have appeared. And I'm not sick anymore, though. I don't throw up. I don't have a lot of acid. I would walk around with 2 liters, like a big Pepsi bottle liter, 2 liters of acid in my stomach, and I would throw up. I'd be at work. I'd have to run to the bathroom and acid like all day, every day, until they cut that out. So when they had done the surgery and removed everything, I don't have that pain anymore. I don't have to worry about that purple pill anymore, which didn't do anything anyways. I think they call it for acid reflux, which was really, the tumors. But not feeling sick anymore, keeps me going. Love of life. I want to get out and explore life, travel, have fun, have some adventure, enjoy my new life with my new wife and her kids. And I like my job. I'm a systems engineer. I work with computers. Matter of fact, I started out with Roger Magowitz, working on his computers back at Mattress Discounters in like 1989. I think I was there to about 94 or 95. Set up his point of sale system. But yeah, so I'm driven by a passion for life, basically.
And tell us how you're feeling now.
I have my aches and pains, but I'm good. I feel great, actually. I've learned to accept any kind of pain that comes over me and just kind of deal with it.
What would you want someone who just diagnosed with pancreatic cancer to know about the disease and how to combat it?
Unlike me, I would say they should not. See, at the time, I was like, oh, God, life is over. I would not do that. I would study. I would learn about the disease. I would learn about the treatment options, the clinical trials, the different types of doctors that are out there that are familiar with it. You know, Roger Magowitz for one. I'm hooking up with TGen and Honor Health here in Arizona. I've seen them now myself, and they've been able to explain to me exactly what happened and what's been going on and what will happen. And with more education and more knowledge about the situation that you would be in if you were diagnosed with cancer, you can process it a little bit better, as opposed to not knowing and saying, oh my God, the sky is falling, you know, I don't know what I'm going to do. Go find the information, look it up, learn about it, and, you know, approach it methodically so that you can process it and understand it, because it's not the end of the world and it can be beat. A lot of people do die from it. I mean, my father watched my mom go through, you know, lung cancer, bone cancer, breast cancer, double mastectomy and a hysterectomy. And then finally, after 17 years, brain cancer took her. So when he was diagnosed in February of 95, you know, he said, no, I said, we can give you 6 more months. You're stage 4. We can give you 6 more months of, you know, life with chemo and radiation. He goes, I watched, you know, my wife, Madeline, do that for 17 years. And that's not a quality of life I want to live. So just give me the morphine and, you know, take the 30 days. And so he was gone in 30 days. But what I would say is he knew a lot about it, and he knew that, you know, what his options were. But that was, you know, 25, 30 years ago. So I would say, or 25 years ago, now there's a lot more information out there on it. There's a lot of clinical trials. There's a lot of treatments that didn't exist. And I would say get some education and, you know, don't give up on life. Get out there and live it.
Bill, thank you for joining us.
You're welcome, and thank you. Appreciate you having me.
Kay Kays is here now to share her inspirational story about her fight against pancreatic cancer. Thank you for being with us, Kay. Kay, when were you diagnosed, and what's inspired you during this journey?
I was diagnosed with pancreatic cancer in 1994 with cismucinous adenocarcinoma. I had the symptoms of weight loss, which I thought my diet was working. I had symptoms of high abdominal pain, which would actually bend me over. And I just thought it was stress or food disorder. And I had fatigue, which I thought I was just, being an avid tennis player and such, I thought I was just being lazy. But they all, in the end result, I found out that those are all symptoms of pancreatic cancer. And I wasn't initially diagnosed when I went in for tests, but 6 months later, I ended up in emergency and I was diagnosed. It returned to my pancreas, which was the removal of my pancreas and spleen. And I had already had my gallbladder back out, and it came in my lymph node. And at that time I was declared inoperable and had to go to several opinions before I was able to move forward with that. And then I've had it in the lung, which I had my lower right lung lobe removed. Mainly because when I was diagnosed, what you have to remember is there was no chemo, there was no treatment except for the Whipple procedure. So even though we have a lot going on now, during my journey, surgery was my only, a lot of times my option.
And how are you feeling now?
I'm feeling good. After going on with what I have had, you know, more surgeries. I do not have a pancreas, a spleen, a gallbladder, or part of my lung. So during this pandemic, it's been a little tough because my immune system is already not having the spleen. is not as strong as it should be. But other than that, I feel very good. As far as doing my advocacy work, I was able to travel a lot.
What would you want someone just diagnosed with pancreatic cancer to know about the disease and how to combat it?
I guess the first thing I would do is tell them to, fight by faith. Every case is different. Be patient active. Get a comfortable, trusty team that you feel you can move forward with. And you need to take care of yourself with mind, body, and soul.
What would you tell the audience tonight about why it's important to support the fight against pancreatic cancer and the Cena Magowitz Foundation?
I have been partnered with the Cena Magowitz Foundation since 2005 when I first met Roger. And I partnered with him to do the very first TGen walk along with his golf tournament. I haven't been able to be as strong with him as I would have liked to because of my traveling and that, but recently I have found out more about the Cena Magowitz Foundation and the gaps that it's fulfilling, not only in research, but needed things for patients and their families. I feel so strongly about what I've seen on this committed people and caring there that on my recent appointment as a one of two patient advocates on the Department of Defense for a $6 million grant that was given to pancreatic cancer, I named Cena Magowitz as my sponsorship because I'm very proud of what they're doing and I felt they needed to be recognized. The reason we're actually in this is one thing I want to mention is pancreatic cancer is even more stronger in the military than it is in the general public. So that's why the DoD has come forward with the $6 million. And because unfortunate heroes that we've lost that have been in the public, as Alex Trebek and Ginsburg and Lewis, next year it'll be 15 million. And so we need to know that cures start with clinical trials and patients should not be afraid of clinical trials. They are our future and we need to be asking about them and moving forward.
Kay, thank you for being a part of our event. We wish you continued health in your fight against pancreatic cancer.
Thank you.
So this is a song called Warrior, and I wrote this for a friend of mine who was going through pancreatic cancer. Her name is Nikki Mitchell. And she came into my life because I played a cafe that she used to run when she was living in Normandy, Tennessee, which is about an hour from my hometown in Franklin, Tennessee. And this song to me is a memory and meeting her, and she really changed my life. You know when people just like come into your life and they kind of change your life forever, and you never know how long they're going to be around, and so you try and take every last just drop of just being with them and enjoying every moment. And she really taught me how to be myself. She taught me how to not be afraid. She was the ultimate warrior in my eyes. And when she told me she had pancreatic cancer, I couldn't believe it, because this girl is like so strong and she looked amazing. She always had a smile on her face, and there was nothing, she would never let anyone know that there was something wrong with her. And then she told me she had pancreatic cancer, and I was like, oh my God, here's a woman that can literally be going through like chemo and all this awful stuff and still look so strong and be so strong. I want to be just like her. And so this song is for all the warriors out there, and this is for the Cena Magowitz Foundation. I'm just so grateful that Nikki introduced me to you guys, and I'm going to play this for all the warriors. And just remember, nothing can stop you. As long as you keep that smile on your face and you remember that every day to just breathe is the way forward. And this is for Nikki. Staring down the face of fear, gotta keep breathing. When the negative is all you hear, you gotta keep believing. 'Cause in the dark there is a light, a truth that keeps on burning bright. Makes you brave to fight the fight and shout the battle cry. You'll never stop me, I'm a warrior. When I fall down, I get stronger. Faith is the shield, love is the armor, yeah. Oh, I'm a warrior. I'm a warrior. I'm a warrior. A warrior. Every scar on my skin is a beautiful reminder of a moment that I didn't give in, and I walked through fire. 'Cause in the dark there is a light, a truth that keeps on burning bright, that makes you brave to fight the fight and shout the battle cry. You'll never stop me, I'm a warrior. When I fall down, I get stronger. Faith is the shield, love is the armor, yeah. I will keep the hope alive. I will find the strength inside. I will keep the hope alive. I am a warrior. I will survive. I will keep the hope alive. I will find the strength inside. I will keep the hope alive. I am a warrior. You'll never stop me. I'm a warrior. When I fall down, I get stronger. Oh, faith is the shield, love is the armor, yeah. Oh, I'm a warrior. I'm a warrior. I'm a warrior. A warrior. I'm a warrior. I will keep the hope alive. I will find the strength inside. I will keep the hope alive. I am a warrior. I am a warrior. You're a warrior.
We're nearing the conclusion of tonight's celebration of hope, but we want to introduce you to one more person who's having a tremendous impact on the fight against pancreatic cancer and is waging his own battle against the disease. Stan Viticus was diagnosed with pancreatic cancer in late 2007. Since then, he's not only bravely fought against the disease, he's also raised a significant amount of money for the Cena Magowitz Foundation's work to fund research into curing the disease. Stan is here with us tonight to tell his story. Welcome, Stan.
Thank you very much. I appreciate it. It's my pleasure to be a part of it.
Stan, tell us about your diagnosis and treatment.
Yeah, thank you. You know, looking back on it now, it's easier to talk about. I really got lucky. I mean, it was very disheartening and disturbing at first, of course, to be diagnosed with pancreas cancer, but I was very fortunate, very lucky, just through an annual physical and some blood work and a very diligent primary care physician and my sister, who's a nurse, suggesting to have my enzymes checked, which happened to be spiked, which led to a CT, which led to an early diagnosis of a tumor. I then had a Whipple surgery to remove the tumor successfully. I went through chemo and radiation. I did have to have another Whipple 5 years later due to some scar tissue and so forth. But, looking back on it now, it was, I'll say it was a walk in the park. So I am very thankful every day to be here. I was very, very lucky.
You not only fought the disease personally, you're helping raise money to fight it. What has motivated you to take the extra steps you've taken to fund research?
Yeah, I'm kind of an analytical, logical person, so I started reading up on the disease quite a bit, and I soon discovered the Pancreatic Cancer Action Network, PanCan, which is a wonderful organization that does research and advocacy and so forth for the disease. And I volunteered for them for a number of years, went to Washington, D.C. to march on Congress to help raise funds. And it was very fulfilling, and I learned a lot in that role. And then, because I live in Phoenix, I had heard about a Cena Magowitz Foundation golf tournament in Scottsdale. So I got together some friends. I'm a golfer. I think we pulled together 3 foursomes, made a nice donation. It was a great event, great turnout. That's where I met Roger. And I also, on that occasion, listened to Dr. Von Hoff speak. And I think that was kind of like the aha moment for me. I mean, when you're in the presence of someone like that, who is so brilliant and has been around such a long time and has such an impressive track record as an oncologist and researcher. And I looked up the fact that he led the Pancreas Cancer Dream Team that received the largest grant from the Stand Up to Cancer National Telethon that went on in 2010. I mean, all across the country, $105 million was raised. And of course, every research foundation was out there asking for that money, right, to do research and use some of that $105 million. Well, the largest grant went to the Pancreas Cancer Dream Team led by Dr. Von Hoff. So that's when I knew that here's where I needed to dedicate my resources.
And what have you done this year for the Celebration of Hope event?
Yeah, so this is about the 7th year I've done fundraising for the foundation, and I set a goal this year of 50,000, which was aggressive. I didn't know if I could achieve that, but I was able to raise 50,000 this year, which put me over $250,000 now in 5 years. And I have to say, it is really fulfilling, and it feels good to be able to contribute money to such a worthy cause. And, I had 90 donors this year, many of them repeat. And the other thing is I got about $20,000 in corporate matching funds this year. And that's something I've really learned over the years, is that you've got to strive for corporate matching, because that's really free money. And so Intel Corporation, Microsoft, LinkedIn, Texas Instruments, Amgen are all companies that provide matching donations. So that has really helped in this fundraising journey quite a bit.
Why do you feel it's so important to fund pancreatic cancer research?
Yeah, I think when I was with PanCan and then working with TGen, I think 2 things. I've really gained 2 primary lessons during this journey, aside from learning way more about pancreas cancer than I ever wanted to. One is that cures follow money. There are so many examples in our history of how this worked, where money was raised for the March of Dimes campaign to eradicate polio, 1 dime at a time. I think $17 million was raised back in the 1940s to eradicate polio and come up with a vaccine. Similarly, Danny Thomas started the St. Jude's Children Foundation in the late 50s or 60s because childhood cancer, leukemia, had a 4% survival rate. He found that unacceptable, and he said, we got to change that. So he started raising money $1 at a time. Now that survival rate is 97%. And then the HIV epidemic in late 80s, that was a very terrible disease, but the federal government threw so much money at research, and now it's a largely chronic disease. Breast cancer has a 91% 5-year survival rate now because of all the fundraising by the government, Susan G. Komen Foundation. And now today, the coronavirus, we thought it might take at least 18 months. Historically, it's taken 5 to 10 years to come up with a nationwide vaccine. Here we are, 8 months into it, and we've got 2 companies ready for authorization of a vaccine. It's amazing. Why? Because of money. I mean, all of these efforts were painstaking, and they took years, and they took thousands of hours of dedicated researchers and scientists, and many failed clinical trials and tragic deaths. But the one thing they had in common was money. Money is what drives cures and progress, and we've got to raise more money to make this happen for pancreas cancer.
Stan, in closing, how can we help?
Yes, this year, I think my main ask is for people to start a campaign fundraising effort. I mean, that's what I've been doing now for years. And the other lesson, I guess, that I wanted to share in addition to cures follow money is that one of the most difficult parts is to get over that reluctance or that fear of asking people for money. I mean, that's where it all revolves around. I mean, Roger is an incredibly dedicated man, but he's one man. He can't do this alone. I can't do it alone, but I have 90 donors now helping. If we could get 100 people doing what I do, it would be enormous. I'll just give you an example of a good friend of mine who I hadn't seen in 5 years. He sent me a note on LinkedIn congratulating me on my 6 years at ASU. I teach at ASU, and I thought, gee, that's nice to hear from Matt. We exchanged a couple of emails, and I said, I think I'll add Matt to my fundraising campaign. And 3 days later, Matt donates $1,000, and he says, my corporation, Xilinx, matches it. And so here I got $2,000 from sending an email. And, I thought to myself, why was Matt so generous? Maybe it's just because he's got a great job now, he's making good money, and he wanted to help. Maybe he has a friend or a family member that's battling cancer, and Matt just felt like this was his way to help them out. Or maybe he remembers 10 or 12 years ago when he and I were good friends, thinking that, I'm not sure if Stan's going to survive. And now he's happy for me that I did. All I know for certain is that Matt wouldn't have donated if I hadn't asked. I've got countless stories like that of people who've come through with significant donations because I asked them. That's the thing we have to get over, is don't be afraid to ask. This is an enormously worthy cause. With TGen and Dr. Von Hoff backing it, people want to give money to causes like this. They just have to be asked.
Stan, thank you for being here with us tonight.
One thing I do want to add in closing is that my ask to all of you is this: please help us, okay? I mean, next year, start a pledge campaign yourself. Denise Sherman, one of our very dedicated supporters, started this last August or so. I think she raised about $3,000 the first year. This year she raised $10,000, and her husband's company is matching that. So she went from 0 to 20,000 in 16 months by starting this campaign. So all of you next year, if you could sign up, I'll help you with the letter. Liz will get you a donation link that makes it as easy as the click of a mouse to get donations. And then you can help. And maybe eventually we'll have 100 people doing what I do. That will move the needle. And ultimately, some years from now, we're going to have an early detection technique for pancreas cancer through all this research. And one of these days, the survival rate is going to get to 60 or 70%. And I want to be able to say I was a part of that. So please, I hope you will too, because that's why we do this. Thank you.
Wow, Roger. I mean, if that speech didn't inspire you to give, I'm not sure what else would. We have had just an incredible evening. I'm so thankful to everyone that has been able to be a part of this event with us. Any final thoughts before we have to say goodbye?
No, final thoughts, folks. This is our last event of the year. If you are ever going to give, tonight's the night to give. I want to thank all of the doctors who gave their time to support the patients. We want to say thank you to the donors. We hope everyone had a great evening. And please, if you can help us out, again, tonight's the night to do it. This is the final event of the year. God bless and have a great evening.
Thank you, everyone. Good night.